think it's important that women know that breast cancer can occur in women under 40. I think sometimes women come in with breast symptoms and they're minimized in that age group. You can't get breast cancer at such a young age, but actually we do know that breast cancer can occur at any age, including teenagers, very rare, but can occur, and in 20s and 30s. And there is recent data now to say that breast cancer risk is increasing in women under 40. Now, it's important to know that still breast cancer in women less than 40 is a rare event, but it's an event that can happen. So what can women do to kind of be proactive? Well, number one is they need to feel comfortable with their breasts and not be afraid to examine their breast. They need not to ignore a new symptom in their breast and really bring it to their provider. But sometimes if they feel like their symptoms not being heard, they need to also be their advocate and push for an imaging test or to see a specialist like myself. It's also important for them to know what their risk factors are. For instance, in the past, people thought, well, you can't get breast cancer risk through your father's side of the family, and that's just not a true statement. We know that 50% of our genes come from our father and 50% come from our mother. So if there's breast cancer on dad's side, that is a risk factor. And particularly if there are other family members that had a young age of diagnosis, that's a risk factor. There are also personal risk factors. We do know that body weight has a direct correlation with breast cancer risk. And we do know that in general, the population is suffering from an obesity epidemic. We also know that sedentary lifestyles can lead to an increased risk. Other modifiable risk factors can be alcohol use, particularly if it's every day or in excess. And tobacco smoking. It's imperative that you don't ignore a new symptom. Be your best patient advocate and find a physician who's listening to you, whether that's your primary care doctor, your gynecologist, or you can actually ask to see a breast specialist and self-refer yourself to a breast specialist who will investigate that symptom and make sure that there's nothing more worrisome behind that symptom.